Hello, everyone. My name is Samir Grover, Executive Vice President of Education at Scarborough Health Network and Associate Professor in the Division of Gastroenterology and Hepatology at the University of Toronto. On behalf of my co-authors, I'm happy to present in this video our recently published manuscript in gastrointestinal endoscopy entitled Establishment of Standards for the Referral of Large Non-Pedunculated Colorectal Polyps, an International Expert Consensus using a Modified Delphi Process. Management of large non-pedunculated colonic polyps demands intricately planned endoscopic techniques at tertiary centers with advanced capabilities. Given the array of techniques available, such as ESD, EMR, and their variants, the decision-making process for the optimal resection method must be meticulously tailored, taking into account the lesion's characteristics alongside patient-specific factors. Our study aimed to elucidate and establish minimum standards for the referral of large non-pedunculated colonic polyps for potential endoscopic resection. This endeavor was not only to streamline the referral process, but to ensure that referring providers are equipped with a clear framework optimizing patient care at a systems level. For this study, we used the modified Delphi method, a structured communication technique to converge upon consensus among a panel of international endoscopy experts. The modified Delphi methodology facilitates a systematic refinement of opinions, culminating in a set of agreed-upon standards. A total of 24 experts from 4 continents participated in this Delphi study, with equal representation of female and male experts. The panel embarked on a rigorous 3-round survey process to initially develop and then evaluate the strength of each proposed standard. The study's outcomes underscore a unanimous agreement among these international experts on the following essential components required for the referral of large non-pedunculated colorectal polyps for potential endoscopic resection. The first is lesion documentation in terms of size and morphology. Particularly emphasized was the significance of accurate lesion documentation. The size and morphology of polyps are critical factors in assessing the risk of malignancy and in determining the most appropriate management strategy. Our findings suggest that a detailed description of the polyp's dimensions and its morphological characteristics, ideally using a standardized rubric, must be included in every referral. This information plays a crucial role not only in risk stratification, but also in selecting the optimal endoscopic technique. The second is the pivotal role of photo documentation. The consensus strongly supports the integration of high-quality photo documentation into the referral process. Photo documentation serves multiple pivotal roles in the pre-procedural planning phase. Firstly, it provides a visual confirmation of the lesion's characteristics, which can be invaluable in assessing the feasibility of endoscopic removal and in planning the resection strategy. High-resolution images allow for a detailed assessment of the polyp size, shape, and precise location within the colon, factors that are critical in determining the complexity of the resection. Moreover, photo documentation enhances the triage process, enabling a more accurate and efficient allocation of resources. It can significantly reduce the need for additional diagnostic procedures, thereby optimizing patient care pathways and potentially reducing the time to treatment. High-quality images can assist in determining whether a lesion is suitable for endoscopic resection or if it requires alternative management strategies, such as a direct referral to surgery. The third is optimization of pre-procedure planning. The emphasis on photo documentation and detailed lesion documentation underscores the need for meticulous pre-procedure planning. By providing a comprehensive overview of the lesion's characteristics, this allows the endoscopist to have a facilitated and more informed targeted approach to endoscopic resection. This allows the endoscopist to anticipate potential challenges and the preparation for necessary resources and techniques, thereby enhancing the safety, efficiency, and effectiveness of the procedure. To implement these findings, we recommend the development of standardized referral templates that include sections for patient demographics, medical history, previous endoscopy findings, lesion characteristics, and then the required photo documentation. Such templates would ensure that relevant information is systematically captured and communicated from referring provider to therapeutic endoscopist, improving the quality of referrals and hopefully consequently patient outcomes. In terms of future directions, we believe that the consensus reached in our study will be a springboard for future work. Clinical practice guidelines for referral networks for polyps, key performance indicators for polypectomy referral networks, and quality improvement studies that are based around these standards. On behalf of my co-authors, thank you very much for allowing us the chance to present this video to you regarding our study.